welcome to MedTech World, and now I'm here with Dr. Sven, CEO of NeoQ. Thank you very much for being with us today.
Thank you very much for having me.
Again, very nice to see you again. This is the more or less third time we are seeing each other in MedTech World networking moments.
That's right, and I think it's great because you meet always the same people, have a lot of things to discuss, so I think it's a great community, so thank you very much, as I said, for having me.
So let's talk about NeoQ. What's behind?
Good question. So NeoQ started in 2019, and the thinking behind NeoQ is to focus on the medical imaging workflow. And not on the scanner side, because the scanner are as fast as they are, more focused on the reporting side, which is the second piece of the workflow, which actually takes up 80% of a radiologist's time. So if you look at the workflow today, normally the radiologist is dictating the report or writing the report. That takes on average 17 to 20 minutes, depending on the pathology and the body region. It can be a bit longer when it's brain, it can be a bit shorter when it's knee. However, it's always around that time frame. So it is also today not structured or machine-readable data because everyone is actually dictating what he or she sees in the pictures. So you cannot really compare reports. So we thought we need to be able to compare reports and to produce machine-readable data, to use that data to then make the care for the patient better. So what we did is we coded 36 million decisions of a radiologist into the software. So any decision a radiologist can ever take for MRI, CT, X-ray. And by doing that, we created a huge decision tree. Meaning today we can reduce reporting time from 17-20 minutes to 35 seconds without using AI. So if you use AI, it's even faster. So what we actually do is we provide the radiologist with a checklist. So he looks at the picture, he does the normal workflow, he does 10 clicks, and then the report is done. He can look over it and then sends it to wherever he needs to send it. We also, at the same time, create a patient-friendly report, so the patient knows what he or she has, and a report for the physician. It's agnostic of language, so you can do it in Arabic, it will come out in German, you can do it in English, it will come out in French. We are integrated already in all major PACS and RIS systems, so it's a very seamless approach into the workflow of the radiologist. Because today, and now I'm focusing on the AI a little bit, is that the AI would produce a secondary report that then the radiologist needs to dictate back into the system, which is a completely broken workflow. So what we do, we can integrate any AI. So it's going to be a platform like DeepSea or Carpal or Inceptor or Ferrum, or it's a single AI like Mediaea or whatever you have. We can integrate that, and we integrate the result of the AI directly into the report. So then the radiologist looks at the report, sees that there is an AI input, and then he can check the AI input, can agree or disagree or change it, and then that's done. So it actually is a seamless integration into the daily work, and it does not interrupt the workflow of the radiologist.
Any story of success you want to share with us?
Well, I mean, especially here in the region, in the Middle East, we see that the people are very eager to use digital AI-driven tools, or let's say digital tools as such. May they be AI-driven or enabled or not. Because the culture here is different. What's happening in the UAE and also in KSA over the last 2 years is that they implemented AI at ministry level. So you have people in the ministry focusing on AI, and they have now shadows in every single institution. So you find AI and data officers in the hospitals, you find that in finance, you find that in retail, you find it everywhere. So there's the mindset of using AI because they see it will help them. Because especially in UAE, where almost only 10% are Emiratis, there are 90% people coming from outside. So language is a huge issue. So our software is able to bridge that language gap. We see on an average when we talk to clients, and we have clients here in Dubai, we have in Abu Dhabi, we have in Jeddah, we have in Riyadh, they say within 100 radiologists you have 25 languages. So in order to bridge that and also bridge the global gap in demand and supply, because globally the people are getting older, because of the aging pyramid and the baby boomers, and you have less and less personnel because people are leaving the job, are retiring, or you have work-life balance issues. So you have more demand than you have supply. And we want to bridge these with digital tools. And I think the region is accepting these tools at a very early stage. While in, let's say, core Europe, more traditional countries, it will take longer.
For how long NeoQ has been in the market?
We are in the market now for 4 years. I think we started in Germany because we are from Germany. However, we realized it's probably for the moment, the less attractive market as Switzerland, Austria, and core Europe, as I said, because people who are using our software are very advanced. If you would look at the adoption curve, they are innovators and early adopters. But in these countries, these people are at a stage in their professional career where they will not make decisions already. So here it is completely different. Everyone is younger. There's a different structure. So that's why I think when you talk about success, it's really bringing something to the region that actually helps them to structure their healthcare network. By doing so, they also increase access to healthcare, which again makes the global supply and demand issue even worse, because you have even more people now needing an exam or healthcare. So that's why they are even more interested in using digital tools.
Understanding that it's a challenging market for you, how do you see NeoQ in the region, in the, let's say, the next 5 years?
I think in the next 5 years, we also need to develop. So what we basically have right now is a great solution for today, and it will be a great solution in 5 years. But we already see that there is a demand. When you talk to clients in Riyadh, especially KSA, they say, we fully understand what you're doing, it's a great solution. However, what we want is we push a button, and then we have the full report, and then we take that report, correct it, and then give it back to you. And there are studies from Harvard Medical School that actually show that it will have a huge impact on productivity and also on quality. So this is something we have now developed already, and that's something we will also announce during Arab Health, that we have this new solution, because we think that's not the next step, but the next step. It will come at some point in time.
Fantastic. Thank you very much, Dr. Sven, and we are very looking forward as well to host you in MedTech World Dubai in 1 month time, 23rd and 24th February.
Exactly. And I might have even something new to say then.
See you over there. Thank you very much.